Health Africa in Tanzania. Dr. Temu holds a degree in medicine, MPH, diploma in palliative care and university certificate in geriatric care health, and now is conducting her Master of Science in Global Management. She has undergone several leadership courses and serves in several boards of governance and advisory committees in Tanzania as well as in Canada. Her areas of interest fall under all the broad of reproductive maternal health and even determinants of health. And she will be glad also to share her view of how we have now gone in focusing on social determinants of health, specifically climate change impact on health. Karibu Dr. Florence.
Thank you so much, Dr. Esa, and good morning, everyone. I take recognition of presence of our elect WHO Afro Director, Dr. Dugulile, karibu sana, and also presence of the Director Services of the Ministry of Health, Dr. Mtuli, karibu sana, and my former boss, who's still my boss anyway, Dr. Eric Van Praag, used to be our chair of the board in Amref, and many others in the room, karibuni sana. The discussion around climate change has been there for years. And for those who were with us yesterday in another session, we see the same thing. It's been there in the years. I remember since my childhood, I could hear about global warming, ozone layer, metaboka, those kind of things. But never did come close to understand how it relates to our day-to-day living, even our health status and things like that. And we know it has been a global discussion all over, even for those who are following up the United Nations General Assembly meeting. That was one of the top discussions there. And also in our regular meetings that we talk nowadays climate change, especially the effects of climate change, how they impacted the health, not just health, but healthcare and health system. So it is really a subject that we should not shy away from it. It has to be part and parcel in our health discussions. The only challenge has been this discussion has been held by other climate change experts and lead to where their presence of health agenda. But thank that the discussion keep going on. Even in the COP discussion nowadays, health takes a major platform. And with the Paris Agreement, where countries are making determined contributions, health takes a larger part. The only challenge remains is the resource allocations. So just to give you a big picture, I'd like to show one slide that would speak much on how our continent is really affected. If you could put the next slide, please. Yeah, this board is from the Africa Center for Strategic Studies and shows there's it's a picture that came out like 6 or 7 years back. But the things that were discussed there are still happening now. If you go around our continent, and these are few that are able to be picked, you can see there's no part of the continent that is not affected, one, and most of the climate change issues are having direct impact on health. And you can go through the cascades of the climate change effects down to the impact that brings to health. And this picture shows those who are depending on fish as a source of protein to improve their nutrition status will be affected. Because fish growth is affected, and they're affecting half of animal sources in the western part of Africa. We can go through each one of them, maybe I won't have to go through each of them, but you can see that the issue of rainfall can still applies where we are. Decreased water levels, but also water points, also contaminated water sources. We are reporting cholera in different parts of the continent ourselves. You can see the air, quality of the air is also affected, so you can have a respiratory issue. Again, we have reported recently as well an article last year affecting maternal health outcome, particularly neonatal or stillbirth outcome because of the climate issues. And we can raising levels of sea levels and the coastal part of where we are in Tanzania as well being reported. We remember the floods that happened around Rufiji affecting health system structures, bringing climate migrants, because people have to move, looking for another location. Affecting our crops, our crops, but also animals, where we rely on our source of food. So end of the day, we shall be reporting high rates of malnutrition, high rates of diarrheal cases, respiratory conditions, because of the environment we have. Even the extreme heat weather, whether too cold or too hot, that kind of thing. So how are we going to cope with this? So I thought we as Amref have been looking at how things are going on across the globe, but also what's the major issue happening in the continent, but also what is our contribution. And next slide, we just show another directive that we picked from WHO, and I'm glad my director from Africa is here. And this guide is being released by WHO. It's a framework that came out in 2015. But how much do we apply it in our programming, in our health programming? This is just a demonstration. It's using the 6 building blocks, just 6 building blocks. And each of them has an intervention towards what we need to do when it comes to health system readiness for curbing the effects of the climate change. And we have challenges along each one of them. Healthcare workers, how ready are they? How informed are they? How do we talk to a patient who is facing diarrhea and cholera in the environment? Do they have source of water? But they're facing drought in their area. There's no source of water. They want to fetch the same source of water, the same source where animals feed. They also take a shower there. They have the same source of water to make food. Then they need to understand what message they need to take across the patients and healthcare workers. Leadership, I think this is about how do we prioritize and how do we have climate governance across our programs. Down to the community levels. We have health system structures, yes. We have local government structures, yes. Down to the community, we have village health committees. Are they well informed about climate issues? Do they package? What do they use? Should we promote electricity or should we promote solar at the health facility? Because maybe you're looking at solar as an alternative, but now time has come, solar has to be the main, and electricity becomes the alternative source of energy. Climate change, the financing, globally, like there's climate green funds, etc. But go and look at that source of funding. What percent is being allocated to health? In the global climate, the green climate fund, I think it's around 0.5 to 6% only to address health issues, while they're most impacted. So you see these, if I can go through each one of them, the question remains and have more questions than answers. So we as Amref, you can remove that slide. We as Amref came up with a strategy that takes us to from 2023 up 2030, where we'll be accounting for the SDGs. And we are very much there on primary health care. And you know that in the primary health care we address everything, all diseases, talking about communicable diseases, HIV, diarrheal diseases, etc., TB, etc. We're addressing through THC. Talking about wash intervention, we build through THC. We've been doing this for many years, but the question came that when we put our next strategy, how are we dealing with the effects of climate change? And we ended up having a strategy that has got not just climate change, but even other social determinants of health. And today, we are seeing clearly, climate change has got greater influence in conditions where we live, we grow, we born, and work. And those are what we call social determinants of health. So climate change has got a bigger stake there. So we have a strategy that has got 2 major pillars. One of the pillars is THC, which we've been doing every day, but we're saying while addressing primary health care, be it non-communicable, communicable disease, wash, whatever, nutrition, we should at the same time address social determinants of health. So we have a second pillar, which is about social determinants of health. So as we are doing our programs, we're also looking on the social determinants of health. So in that area of climate change, we've got 2 major areas we're looking at. One is on the mitigation and adaptation of climate health effects, climate change effects, and another one we are looking on addressing disease outbreaks. And this is more to do with the surveillance, early detection, and the response. And you realize from this data that I presented there, from WHO reports that out of over 2,000 cases that were reported of outbreaks, over 56% were climate change related. So here we are leading that situation. We have to take actions ourselves, but we need to ask actions at what level? It starts from your own level as an individual, goes to your family, to the community that you live with, our government, and each one of us. Climate change, effects of climate change is just there, the next door. It's just with us. We are living with it. How do we live with it? We have our great panelists here who will be telling us about their experiences, and I'm here actually very delighted that we've got a big audience here to listen and contribute. So asanteni sana and welcome to the discussion.
So much, Dr. Forrester, for starting this very insightful and exciting conversation on climate change impact. I call upon the speakers. I would like to recognize also the presence of development partners, CDC and DOD, the government counterparts, Deputy EPS, Minister of Health Zanzibar, Director of Health and Nutrition Services, PRH, Program Manager Nashco, and RMOs of different regions, Simiyu to Yanga, non-state actors, and I think the others were already introduced by Dr. Florence previously. We have the presence of the WHO Afro Regional Director-elect. So much now I'll start with calling upon our esteemed speakers. I'll start with the Engineer Colonel Mashallah Kama. He's the Deputy Chief of Party of USA Emergency Project. He is a registered professional engineer with over 20 years of experience in civil and public health engineering and program management. He has worked with various international organizations, including World Vision, WaterAid, Amref, Plan International, and is currently the Deputy Chief of Party of USA Emergency. Kema has extensive field experience across East Africa, leading WASH education, health, and environmental projects. He holds a Master of Science in Tropical Public Health Engineering from the University of Leeds and has several leadership, strategic management, resource mobilization, and consultancy roles within Tanzania. Let's put our hands together for Engineer Kama. Our next speaker is Mr. Darcy Williams, nutrition specialist in early childhood nutrition governance, works with UNICEF Tanzania. Is focusing on early childhood nutrition and governance. He has worked in more than 20 countries on programs to improve maternal and child health. He played a key role in developing UNICEF's global food system strategy, with focus on policies that benefit both child and planetary health. Darcy is pursuing a director PhD in epidemiology and population health from LSHTM at London School of and holds an MPP from the University of Cambridge as a Gates Cambridge Scholar. Welcome, and put our hands together. Darcy. Our third one will be Mr. Charles Dismas Malin, the head of vector control units at the Ministry of Health. Charles Malin is an experienced epidemiologist and vector control specialist with over 20 years in vector-borne disease control, holds a Master of Science in Applied Epidemiology from MUHAS and Master of Science in Biology and Control Disease Vectors from the University of London, along with a postgraduate diploma from LSHTM. Currently head of Vector Control at the Ministry of Health and trainer of Vector Control Training Center, Amani Muheza. Expertise includes vector surveillance, prevention and control, implementing indoor residual spraying, insecticide treated nets, and larva source management programs. Wealth of experience. Let's put our hands together to Mr. And our fourth speaker is Engineer Preparedness, is our program manager for water and climate change. Is also leading a portfolio of social climate affairs at Amref. He's focusing on WASH, public health security and climate resilience. He has a Bachelor of Science in Environmental Engineering and Master's in Environmental Science. He brings 21 years of experience in building community resilience through climate adaptation and market-based sanitation. He pioneered the solid waste circular economy program, which we are implementing in Amref, turning biodegradable waste into biobriquettes for clean cooking, benefiting both climate and livelihood. Previously, he held roles at SNB, Water in Tanzania, WWF, GIZ, and Ministry of Water Tanzania. Let's put our hands together to introduce James. Thank you so much, speakers, for. So I'll start quickly with getting them to speak, and we'll start with Kone Mashala Kama. The poor sanitation and hygiene can increase the risk of climate-sensitive disease outbreaks, and particularly we know the waterborne diseases such as cholera. And the Tanzania HNAP noted, you know, the HNAP, the planning, the climate change HNAP plan, noted that cholera is one of the most significant climate-sensitive infectious disease in Tanzania, and that weather and climate variability such as El Nino, floods, and etc. We've seen an increase of outbreaks. So can you share your view in our context on the extent of community vulnerability to the climate change-induced extreme weather conditions in terms of access to clean water and optimal sanitation? Karibu Engineer.
Asante sana. A very good morning, everyone. And I'm profoundly honored to have this opportunity. As indicated by the keynote speaker, the climate change really affects broadly. And Tanzania as a country have done a lot. They have tried a lot to improve water and sanitation facilities as to meet the SDGs, especially goal number 6, clean water and sanitation facilities. And as we speak, Tanzania has recorded the access to clean and safe water basic by almost 80% by June this year, while urban coverage is almost 70-80%. However, with all these efforts, based on the climate change challenges, that's where we see a detrimental impacts in 3 major categories. One is the direct impacts, which really affects much of the communities where you may experience death, physical injuries, among others. The other key impact is the ecosystems mediated impacts, of which was with the air pollution, flooding, etc., etc. And lastly is the social mediated impact, which goes up with the migration of people. And most of the people who are affected, women, children at large. So even the systems infrastructure that already has been developed, the country has made efforts to reach this proportional percentage of access to basic water supply services, sanitation services, becomes more or less not used at the end of the day. And that's where we experience outbreaks of cholera and the other diseases. We saw this a year ago in Manyara, Hana, how the impact really affected. That was an outcome of the climate change. We saw almost 2 years ago in Dar es Salaam, where a city was short of water supply services because of the impact of the climate change within the Wami Basin Water Board. So, as a country, Tanzania is divided into 9 basin water boards. And majorly, the Wami Basin, which has almost 11 regions across the country. So, what role this basin water boards does? They are supposed to share data that are being generated from time to time from the rivers, from the dams that they manage, so that this data can provide sufficient information to the systems to be able to acquire and plan effectively. As we speak, through the Ministry of Water, we have developed something which is called Operational Decision System Support System, or THS. This is a system that enables to enhance gathering of information from various basin water boards in relation to the climate change. And this helps really to facilitate and track the effects of the climate change within the respective areas, whereby they can be shared with the planners to effect the smooth uptake of the designs, of the planning, among other issues. So, if we are to address the challenge of outbreak, including cholera, as among of the key gaps which are really affecting the country, and as we speak also, Madam Moderator, the country across all the regions are hit by cholera. And mostly the lake zone, Mwanza and Simiyu among the top regions which are being affected by cholera. But what is, I think, the major key gap is the information and the systems in terms of planning, in terms of coordination, and in terms of where do we start the planning. That's where the gap is. So to strengthen the primary health care into perspective of climate change, the information sharing has to trickle down to the beneficiaries. Thank you.
Thank you so much. So, what's your opinion in terms of building adaptation to climate change? I know you started sharing that information, sharing of the information, trickle down information, maybe translating the weather information which is shared. So what's your opinion in terms of making the community resilience with water, sanitation, and the hygiene?
Thank you, Madam Moderator. The present we depend most on the Tanzania Meteorological Agency as the primary source of information on the weather on related life. However, as I said, we have the basin water boards, 9 basin water boards across the country, of which they are the ones really close to the communities, whereby I feel they are not really sharing the messages of the information that they generate. So enabling the systems at district level, at regional level, to have a thorough planning. That's the gap. So if we are able to strengthen this aspect of that information sharing to be adapted to the healthcare committees at village level, at ward level, so they are able to internalize and integrate of what they speak is most usable within their context. We can make a step forward. Thank you.
Thank you so much. Very good. Thank you so much, Engineer Kramer, and now I would like to have get some insights from Mr. Darcy Williams. As a consequence of climate change, we have experienced increased and intensity of drought and foods with negative impact on food crops, livestock leading to food insecurity, an increase in burden of undernutrition, which mostly affecting women and children, of course, especially in rural areas and areas which we have already discussed previously that are intensely affected by. So in your capacity as your nutrition specialist at UNICEF, so what is your opinion or experience on the scale of climate change impact on food security and burden of undernutrition among climate change affected communities, specifically in Tanzania and context?
Asante sana Dr. Muya. Tanzania oye! Tanzania oye! Kwanza leo. Okay, safi sana. First of all, asante sana to Amref for organizing this and our esteemed guests today. It's a pleasure to join you and all of the great speakers on the stage. So from my perspective, it's quite clear the relationship between nutrition and the climate crisis is a bi-directional relationship. That's why UNICEF, we've been calling it the climate crisis is a nutrition crisis. Of course, you've also heard the same thing in every sector. Climate crisis is a loss crisis, is an education crisis. It's because it affects multi-sectorally. I might be a little bit more biased because I'm a nutritionist, but from my perspective, it's this bi-directional relationship between child nutrition and the climate crisis, which offers unique challenges, but also some unique opportunities. So we know that this bi-directional relationship is driven by a failing food system that's not only contributing to more than 30% of global greenhouse emissions, but the same food system is driving a triple burden of malnutrition in many countries around the world, and Tanzania included. So what do I mean when I say triple burden? I mean undernutrition, which includes stunting and wasting. I mean micronutrient deficiencies, which is hidden hunger. And I also mean childhood overweight and obesity, and we'll get to that. So within those three, for undernutrition, you see it's kind of the classic relationship you have seen. The climate disasters are causing huge shortages in the quantity of food, which is throwing many children and many families around the world, including Tanzania, into food insecure situations, and also driving them into severe child food poverty, which UNICEF defines as children consuming less than 2 food groups a day. And globally, 200 million children under 5 are living in severe food poverty, and that is highly associated with regions that are also at greatest at risk for climate. Those same climate shocks are also causing huge disruptions in child food practices. So with a disproportionate burden placed on women, a lot of the caring and feeding practices are quite difficult. And then also we know, as my colleague just mentioned, the effect on clean drinking water, which results in disease and then also results in severe malnutrition. Now for micronutrient deficiencies, the problem is a little bit more hidden, which is why we call it hidden hunger. Not only are we worried about the quantity of the food going down, so the number of staples, wheat, rice, maize, and also nutrient-dense foods like fruits, vegetables, legumes, but we're worried about the micronutrient quality of that food dropping. So we know there's an association with higher CO2 in the atmosphere and lower rates of important micronutrients like zinc, iron, and vitamin A. And for example, some studies have come out that have shown with rising CO2 levels, you have about 175 million more people globally at risk of zinc deficiency, and even worse, you have 1 billion women at risk of anemia because of a complete decrease in iron from their daily diets. Now for overweight obesity, this is the area some people don't really know how it's connected, but the childhood overweight obesity crisis around the world, which is here and coming in Tanzania, is driven by the production, marketing, and consumption of ultra-processed foods. Those same foods and the companies that produce those same foods are also driving environmental degradation, and those foods are connected to greenhouse gas emissions, biodiversity loss, pesticide pollutions, plastic packaging pollution. So you can see across all the 3 forms of malnutrition, the there's a direct correlation with nutrition and climate, and the scale is incredible globally and also here in Tanzania.
Oh, thank you so much. That's very good and factual. And so when it comes to sustaining child nutrition in regions that are severely impacted, what's UNICEF's main priorities? And what about mitigation efforts that you do to protect children in the long run?
Thanks, Asante sana, Dr. Guia. So that bi-directional relationship I mentioned, while it's challenging, it also offers an opportunity. If you can work through the food system, you can both adapt to the climate crisis to protect child nutrition today, but you can also then mitigate, because we can't just focus on today, because that was the problem. That's why we're here today, is because we only focused on today, we weren't focusing on the future. We also have to make sure our interventions for nutrition and agriculture mitigate child malnutrition today and climate crisis in the future. So in terms of adaptation to sustain child nutrition today, you have the classic agriculture interventions, and in Tanzania the government's leading a lot of innovation when it comes to climate smart techniques. We have improved forms of agroforestry, improved seed varieties, we have improved innovations with rainwater harvesting. I think I'm relatively new to Tanzania, but I think I've heard correctly that the government is piloting some interesting programming in Arusha in the drylands called Chololo pits, where they're working with smallholder farmers to dig pits in the ground during the dry season. When the rain comes, they fill those pits with fertilizer, and then those smallholder farmers have a little bit more moisture to work with than they would usually, and they can produce more during the dry period. Now, from a UNICEF nutrition perspective, our nutrition programming looks to amplify those agriculture interventions. So we look to strengthen community systems so that community resilience builds to eventually deliver nutritious diets, services, and practices for children and families. So our 4 key priority areas for adaptation, the first is improving child diets through public policy. So that's working on the pipeline of therapeutic foods, fortified foods, supplementation. That's also improving child services, both in health facilities and with community health workers. So breastfeeding, also micronutrient supplementation. 3 is working on practices, which is supporting positive individual behavior, but also positive gender and social norms. And then the 4th priority action is integrating the early detection and treatment of wasting in all programs and services. Now, on the mitigation side of things, we also want to figure out, okay, how do we prevent all forms of malnutrition today? So undernutrition, micronutrient deficiencies, overweight, obesity, while also preventing further environmental degradation. So again, we have 4 priority actions. The first is to improve child diets. And the number 1 intervention here we like to focus on, if you're thinking of UNICEF and nutrition, what is the first intervention that comes to your mind? Of all of them. What is UNICEF known for? Anyone? If you were to think of UNICEF and nutrition and first 6 months of life, what intervention are you going to think of first? Breastfeeding. Bingo. Breastfeeding is the most pro-climate, green, carbon-neutral intervention for child nutrition while simultaneously disrupting the global supply chain of baby formula, which is disastrous for the environment with their use of water, their plastic packaging. And so that's key and something we've been doing for years. 2 is to use fiscal measures so that simultaneously you make sustainable, low carbon, and nutritious diets affordable and accessible to every child and family. 3 is the standards and regulations around schools. So that means making sure that schools can, in and around schools, you can access low carbon, sustainable, and nutritious diets, especially fortified foods. And then the last one is my favorite, which is food environment policies. So these are food environment policies that reduce the consumption of ultra-processed foods, which is also reducing the risk of childhood overweight obesity. But at the same time, those same policies have an environmental positive effect because you're reducing the consumption of these products that are produced by these companies that are destroying our environment. And so those are examples of restricting the marketing of junk food to kids, but also front of pack nutrition labeling, which we're working on with the government in Tanzania. So from our perspective, we have to think about adaptation and mitigation, and then we'll set ourselves up for a better future. Thanks.
Great. Thank you so much. That was a very, very good conversation, and thank you so much. Just now down to it's an isthmus. So climate sensitive vector-borne disease being associated with either directly or indirectly with global climate change globally. I think that's a big discussion around that nowadays. And for example, a number of climate associated with vector-borne disease epidemics, including malaria, dengue fever, specifically those are the ones actually affecting our communities. And there's been reported in various new geographical locations where there was low prevalence of malaria. Now malaria is on the rise. So what can you tell us regarding the extent of which climate change is affecting geographical spread and seasonability of vector-borne diseases like malaria and dengue fever, specifically here in Tanzania?
So thank you so much for that nice question. First of all, I'd like to mention some of the few vector-borne diseases which have been occurring in Tanzania. And when we are talking about vector-borne diseases, we are talking about diseases that are transmitted by vector. And here we speak about mosquito and some other flies. But specifically for malaria, I'm sure you all know that the malaria is transmitted by mosquito. And these mosquitoes are called Amref. And the dengue fever are transmitted by mosquito called Aedes mosquito. So all these mosquitoes, in order to breed, they need the optimal range of temperature, but also they need the optimal range of rainfall. So there is a direct association between vector-borne diseases and climate change. For mosquito, in order to breed, they require optimal range of temperature, and this is why we say malaria has a direct association with the climate change. But also, you know, mosquito breed in water, particularly stagnant water, and in order to have water, we need to have rainfall. So you will all know that during rainfall, we experience a lot of cases of malaria, and this is because there's a plenty breeding cycle for mosquito. There are a range of mosquito, like anopheles mosquito, they breed in clean water exposed to direct sunlight. But suicide mosquito, they breed in polluted water, but all they need water. So during the rainfall, we experience a lot of breeding sites, and just after rainfall chase, there is where we start to experience mosquito breeding in cases of malaria. But you all know that during the rainfall, when there are stagnant water, rainfall tends to wash the breeding site. So heavy rainfall has also an impact on the control of breeding site because they flush the breeding site. Mosquito require a stagnant water. If water is moving, mosquito cannot breed. But talking about the temperature, there is optimal range of temperature which are required for mosquito to develop from immature stage to adult, and the required ambient temperature is ranging from 21 centigrade or 25 to 27 centigrade. This is the optimal range of temperature which is required by mosquito to breed. So at the very low temperature, mosquito cannot breed. That's why there is again a very strong association between temperature and malaria. I'm sure you have seen the malaria certification method. At the middle of the corridor of Tanzania, malaria is very, very low, and you can all appreciate that. And this is, apart from the intervention which we are taking along those areas, but also the low malaria is because of the low temperature. Because mosquito need to live at least like 28 days at optimal range of temperature. So for the malaria parasite to complete their cycle in the mosquito body, in the gut of mosquito, they require optimal range of temperature. If the temperature is very, very low, malaria parasite cannot complete the life cycle of the body of mosquito. And I say, in order a person to get malaria, you need to be bitten by mosquito. And these are the mosquitoes which have the parasite. So the parasite need a certain range of temperature to complete their development in the body of mosquito. So there is a very strong association between temperature, rainfall, and malaria. But again, there is another dimension very change, which is humidity. And by humidity, this is the amount of moisture content in the air. So the activity of mosquito is also influenced by relative humidity. If the air is contained a maximum range of moisture content, the activities of mosquito become very active. And the survivorship of mosquito is influenced by relative humidity. So this is another dimension of climate change which influence malaria and dengue transmission. But again, drought, as has been said by others on the issue of cholera and nutrition, but again for malaria, drought has an effect on the transmission of malaria. And that's why we find some areas have a seasonal malaria transmission, and this is because those areas are so dry. And in some places there are pools of breeding sites, and those they act as a source of mosquito breeding sites. So to emphasize here, there is a very strong association between climate change, temperature, rainfall, and transmission of affectable diseases. Thank you.
So much. Yeah. And just a follow-up question. What can community-based health intervention play to mitigate the increased transmission of affectable diseases due to climate change?
So thank you so much again for that questions. As I said, a mosquito breeding in stagnant water. And if you have a pool of stagnant water, those are places where mosquito can breed. So there is a role which community can play to make sure that they distract the breeding site. Because if you distract the stagnant water, mosquito can no longer breed. So community engagement and involvement in the environmental sanitation and resource reduction is very, very important. And this is the key. Because we also use some insecticide, but insecticide are last resort. We use insecticide when there's a high transmission of disease, but the primary prevention for vector-borne diseases, particularly diseases which are caused by mosquito, is source reduction, making sure that the area within the vicinity of the household they are free from stagnant water. So that is one. The second intervention is community education and promotion. We need to impact the community with the right practice, right knowledge to make sure that they know the best practice to tackle malaria prevention and mosquito prevention. Because mosquito they breed, as I said, in the stagnant water, and these stagnant water are within the community. So we need to give the community education to know where mosquito they breed and to take the initiative to make sure that we distract the breeding site. But another dimension is the house improvement. There is a very strong association between poor housing and malaria transmission. So if community they improve their house, making sure that they put mosquito screening, they reduce exposure to mosquito bites. So this is another issue which community can play a role to make sure that they prevent malaria. But another, but not least, is the community-wide use of preventive measures. As a government, we are providing mosquito net, and this mosquito net are given free of charge to the community. So, in order mosquito to give protection to the community, we need the community. The community must use the ITN. So, if you use the ITN, you will reduce the risk of exposure to malaria. So, these are the key things that the community can play to make sure that they distract the mosquito breeding. But another issue is habitat avoidance, because there is a tendency of community to construct houses in marshland areas which are potential for mosquito breeding. If the community they can stay away from vicinity to the breeding site, they will reduce the risk of mosquito bites. So that is what I can say, and thank you so much.
Thank you so much. So communities can reduce breeding areas, potential breeding areas for mosquitoes. I think that's something that people can do. So I'll now jump to our last speaker, James from Amref. So in recent years, Tanzania experienced natural disasters involving extreme rainfall leading to flood and landslide, which have been attributed to the effect of climate change. So as the government continues to implement disaster response efforts nationwide, key stakeholders, including Amref, committed to support effective disaster management and response strategies in the country. So what can you share with us about Amref's role in supporting the adaptive response in some communities affected by, for example, the landslide in Hanang district in Manyara and extreme floods which happened in the Fiji Valley region?
Yeah, thank you, moderator. Good afternoon. Thank you very much again for that good discussion, and for the question that has been posed on me, is that we all know that we have already have a climate crisis. All the speakers have mentioned the crisis that we have, from the ecosystem good and service provision, from the water resources, food service, but also on the health impact. So we are struggling with today's climate variability, as we all feeling right now, but we are also struggling with tomorrow's climate change. Today's climate variability, I mean, when we see the weather change pattern as of now. But when you count in a long-term pattern for 50, 100, and whatever, that's when you say climate change. So the climate change is heavily brought by the change of extreme weather events that will lead to failure of ecosystem good and service provision. We have been seeing the number of social determinants that are affecting heavily on our health. But today we are here to discuss what is the robust measures and the practice that has been taken with other players, including Amref, to adapt to this climate crisis on water, sanitation, and hygiene. So the climate crisis has heavily affected our health system provision, because we were discussing how can we make our health system resilient to climate change effect. But also this has affected heavily on our community resilience to live within the change of climate. So as the health portfolio for Amref, where we are looking on the primary health care and social determinant for health, we are now going to discuss the effect on water, sanitation, and hygiene. But why water? If I can test my thinking, my theory of change, I guess that everyone has already tested maybe touched the water this morning or visited a toilet facility. Isn't it? Have we all touched the water this morning or visited a toilet facility? Are you sure? So my guess is true that the water is the primary health drivers. The water is the primary economic drivers, but also the health output indicator. And further, the water is heavily affected by the change of climate. When you talk about climate, you talk about the water cycle change. You talk about the change in ecosystem, food and service. So the water is a health basic need for everyone. sanitation is the basic health need, and also the hygiene part. More than 2 billion people are still struggling with water, access to water, but this will be even double more if we are not changing the situation globally. We are struggling with the functional health societies or functional health systems. If we don't have plenty water, sanitation and hygiene, our health systems are very heavily affected to provide their health services. So we are threatened by the climate changes. And when we're threatened by climate changes, it's not only the health system but the community that we are saving. This climate change is leading to very high inadequate access of these precious services, especially for women, young and girls. Now we are talking a lot of the menstrual hygiene management. So what Amref did and why Amref has been doing this to address the climate change, it has already been well said by the country director, by the previous speaker, the moderator, that Amref is now trying very much to sustain the services that we are putting at the primary health care. But how can you sustain these services? We should make sure that the social determinant is adequately addressed, especially the climate change and the wash systems. We are addressing the global SDG number 6, as already mentioned by other speakers, but we are also addressing the SDG number 1.5, which is calling for resilience health systems. We are discussing mainly 3 things if we want to address the comprehensive health resilience systems. We address the infrastructures, how we are putting our wash services, how you are positioning the wash facilities, how you construct the wash facilities, how you put the materials and the workmanship. But importantly, we are dealing with the institutions. Amref has been working very much with the institutions to build their capacities to ensure that they can be timely responding to the climate crisis. For example, in Ghana, how have we worked with the institutions to make sure that they are responding timely and they are addressing the issues that happen at community level? But importantly, we are also working with the communities. So 3 things that you should remember on addressing climate change resilience: institution, infrastructures, and the community. The community, how do we deal with the community? How do we empower the community to make sure that they are clearly understand at the local level issues about the climate vulnerability, climate adaptation, climate mitigation? We have a lot of players and other sectors that are dealing with these climate changes. How are we coordinating and get the precise message to get to the community so that this community can be able to respond, to communicate, and to adapt to the changes? So Amref, we have been working with other players, CDC Tanzania, in Ghana, to start by analyzing the situation. How these situations have affected the community? We have worked with the institution to make sure that we build the institution capacity in responding to the climate hazard and the climate vulnerabilities. And also we have worked to ensure that the capacity as a cross-cutting issue is well transformed to within the institution and within the community. So in Ghana, to make it summary, that we have worked and we have collaborated across the other partners to ensure that the climate resilience frameworks are well addressed. We have worked on the vulnerability assessment. We have done the vulnerability assessment there just after the landslide event. We have worked on the exposure of the community, especially the people who have been much affected by the slide. And we have taken all measures of technology to ensure that we are putting in place smart climate technologies for the people to be to gain their survival and gain their livelihood. So that's what we have done in Hana.
Thank you so much, Julie. And I believe you can also share what other stakeholders in the government can work together in terms of specific preparedness and response for such aftermath of climate change. Very briefly, what's
as already mentioned by the moderator, but also other players, speakers, is that the issue of climate is not a one-man show or a one single sector to address or to respond. As I said, we have multiple players, multiple sector, and cross collaborations. As we are speaking here, we are many sectors, many players that we discuss a single climate crisis, but we have multiple approach and multiple collaboration. So from the global understanding is that there are a number of collaborative initiatives from the COP up to 29 now. We have the international treaties, how can we work together on the climate issues, but we have the local and the national guidelines and the principles. So at the local level, as I said, we have been working with different players, as I mentioned, for example, CDC, the government, and the leading stakeholders, the community, and the cross-cutting issues, sectors. For example, we have been working with the TMA to get the information, the climate services information to trickle down to the community. We have been working with the Minister of Health, very comprehensively. We have been working with the Minister of Water to ensure that water are available and accessible by the community. We have been working with the Minister of Education to ensure that this education are trickled down to the pupils and to the community to ensure they have a proper education. But importantly, we have also been working with the community health workers to ensure that these are the frontline workers that are pioneering and take the climate change issues and understanding at the community level. So it's a multiple discussion, a multiple collaboration, act at the local but effect at the global scale.
Thank you so much. So thank you so much, speaker, our distinguished speaker. You've really given us a lot of information for people to digest, and I'm sure the flow participants would really want to maybe know more insight from you. So I would now want to open the floor for questions and answers, and we started a number of questions. In case you want to get further clarification or comment or to our speakers. The floor is open, and we need to get some microphones. There's one there. Somebody distributing the mic. Hey there. Maybe a round of 3 or 4 questions.
Thank you very much for the comment, and I'm actually doing some word counts. One, the first word is resilient communities. And the second one is adaptation and evolution. The one big question that I have, again, this is for the panelists, is what I would say is that anyone talking about the collaboration or interaction, we've all talked about various, we've all talked about very good, excellent initiatives. But what I've not seen is the integration. What is the approach for integration? You've talked about, it's very good that we are collecting from, sure, it's the Safe Water Project. You've talked about the operational decision support system, which is very excellent, influencing planning and design. How is that influencing all other programs across the country? How is the effort from UNICEF, the Ministry of Health, the National Malaria Control Program, Amref, how are these coordinated? We used to have the One Health approach, the desk within the ministry, the Prime Minister's office. What is the role of the One Health desk in terms of coordinating these small efforts and incorporating predictive models to foresee future emergencies?
What is the role of the One Health desk in terms of coordinating these small efforts and incorporating predictive models?
Thank you. My name is Ayub Da, a medical student from Beirut University. Thank you, panelists, for eye-opening discussion about the effect of the climate change. But my comment from my concern, I'd like to thank Mr. Turi addressed that there is a multifactorial thing that should be addressed in several areas. But I would like to know the role that has been played to the local governments to reach at that very local level of the citizens. Because in our society, the climate change is still mostly seen as a natural calamity, especially for things such as heavy rainfall or floods. This landslide is seen as just a natural calamity coming from God, but it's not. The citizens still, they don't know that they have a part to take to reduce or to omit these changes which bring a lot of effects such as washing off plantations, which bring about a lot of effects to the community and nation at large. So I'd like to know the roles or what efforts is done at the local government to reach out to the citizens to get this education, to have a role to play in changing this.
Thank you so much for the question. Can you pass the lady here and then somebody?
There was much focus on there was much focus actually on diseases, cholera, malaria together. But here, different issue, which I would also like us as part of the health, specialists and the technical, we look at it. The issue of climate change is central to climate effect. Most of the time, I think it's the issue that is like there's no harm to climate change. But we have seen in the Hana landslide, we have seen in the farm in the city. I have examples people, women who are really better with the labor just covered by land. How would that come out? And we started when we had in the yellow, we were able to that kind of situation. Or at least the area quite sure that we have also a clear adaptation plan for such kind of issue. Because you know, people want to deliver, yes, but also people go to what this is one issue. But the other thing, I'm looking also into, I feel that the issue is also an individual kind of issue. The issue of adaptation starts, I think, also for us as individuals. At least I'm looking at it, how do we maximize the use of technology to ensure that, for example, our meeting successful, many other things. Most of the time, we have the trouble, but in the case of the sector, they have on emissions. There's a lot when we look into the calculation, how much we are storing regularly for travel, for the printing documents, just not switching off for light, the light, very simple things. But this is what behavior, which might be to adapt as well. And my last thing, looking into the issue at Omega, I remember when during COVID, because people, everybody was afraid of COVID, because people died. And then there was water everywhere and salt. And remember in back to school, whenever somebody's a drink with water, everybody was washing their hands. And I remember the minister gave the data that other than that, was not there during COVID. That will be my witness as well. Then, that is a very good positive behavior. Why didn't we maintain how we make as an expert to promote such a behavior so that we don't need to be suffered everywhere? Then, for things that are medicine, just to put in and go accident, just to change your behavior. So, some of these things I feel that it's important that I bring them here. We can really discuss. Thank you very much.
Very much. And one last question, then we can respond, then we'll go another round. Yes.
Thank you so much. First, I would like to comment on the insights and information that is being delivered by the panelists. But I have one concern, and any of the panelists can address this. My name is Leon Justin, I'm still from St. Francis. Now, with regard to One Health approach, I am curious to know, as a country, are there initiatives to consolidate health practice that we daily do, or clinicians daily deliver the services to the clients with the issues of climatic agendas or not? And if there are, how well implemented are they? Or can we come up with a good framework to integrate these two components? Because we see there is a great difference between climatic changes with health. Yesterday, I just got amazed how there is a movement to link between these chronic diseases like HIV with NCDs. Whenever a patient comes with these non-communicable diseases, they screen for the HIV, or HIV, they screen for NCD. How do we interlink health climatic agendas with health practices? Thank you.
Thank you so much. And before our panelists respond, I would like to invite the Tuli to share a bit of a response of some of the highlighted. Can you pass this?
Thank you very much, and I must commend the panelists for the very good observations. I think there are some of the things maybe missed from the panelists, but this is not something to blame. The policy perspective. Right now we have the National Health Adaptation, Climate Adaptation Plan. The first one began in 2018 to 2023, and right now we have just finished the second one, and I must commend Regional Director for WHO Afro-Elect, Dr. Faustin, because he created an impetus for that to happen. He gave us some inputs, and that will begin from 2024 to 2030. So among other things, about 10 components. In each component we have strategic objectives. A couple of questions which have been asked from the floor, actually they are part of those components. And one of the very, very important thing which has been addressed in the National Climate Health Adaptation Plan is the issue of integration. And in that document, it has clearly spelled out that primary care, that will be the point of integration. And I think that's the essence why we're having this theme, that we need to capitalize on the presence of very strong and robust primary care in the country. And with regard to issues a bit touched by my sister Felista on the issue of reproductive child health, the issue with mental health, they are all part of the new national climate change adaptation plan. So it has also touched on the how to deal and how to go about with the issue related to the maternal, newborn, and child health, the issue of effects of temperatures on the maternal health, the rise in the sea levels and other things that were mentioned by the keynote speaker. So we have a policy document in place, and we will soon start to disseminate to different stakeholders. This is a very important issue, which we cannot afford not to share to different people, because in so doing we will be left behind. Every nation around the globe is running behind, making sure that they create health system that is resilient and is adaptable to the climate change. We have had a number of resolutions from May this year when we were attending the World Health Assembly, going to Congo Brazzaville where we get also new regional director elect, but to UNGA last week we also had that. So what we're doing now is to make sure this document aligns with all these international and regional resolutions, and also the commitments that are being given by the head of states. So I thought I should compliment to our colleagues here, because that is a very important document to have and also to be spoken about, because it will enrich the discussion we have right now. Asante.
Thank you so much, Dr. Tule. You have really helped in clarifying a lot of questions which people came up, and I think we have seen the Health National Adaptation Plan that was ending 2023, and I'm glad to know that we have a new one which is developed and to be shared. I encourage people, stakeholders here, to get hold of that. Well, that's very key now. Is we're implementing health and administrative primary care. It's very important to also make sure that we are integrating climate change resilience interventions in our programming. So I'll let now the start to respond to any questions from the rest, and then just few because we are running out of time.
Asante-san. And thank you, Dr. Nchuli, for flagging the great work we've done in Tanzania. I also wanted to commend the government because in the topic of integration, the current restructuring of the community health worker program here in Tanzania is working on that integration to prevent the silos and all the different NGOs and UN agencies working in all these different sectors with a different variety of community health workers, but now the government has decided to bring them all together to create a very robust, integrated approach. And within that, when we talk about adaptation to protect child nutrition, that's one of the key aspects of the new curriculum. And just to comment on my esteemed colleague from UNFPA, I think it's Farista, Absolutely. The climate crisis is a gender crisis. It disproportionately affects women and girls. Like I mentioned with post-disaster and beyond just sexual reproductive care, you also have the caring duties of women are significantly hampered, and the burden is crazy. It all falls on the women to do the caring and to do the recovering. And I really liked, I do agree with you, the important role it does begin with us. And I also want to say for us not to take our eye off the ball, that the structural change that needs to happen in the systems level and the regulatory level, working closely with government to regulate the systems and the companies that are driving a lot of these issues. And I always say this, I don't know if most people in this room know this, but does anyone know where the term carbon footprint came from? Anyone? The term carbon footprint. Anyone know where it came from? It came from the oil industry. The oil industry made that up 30 years ago because they wanted to take our eye off the ball and make us focus on individual behavior while they were messing up the systems in place. And the same thing is happening now with food systems and individual behavior versus allowing food companies to just run wild with our food system and destroy our health and our planet. So we have to do both. It starts with us, it also starts with us working with government to regulate the right companies to do the right thing for health and planet. Thank you.
Thank you very much. If there's any question addressed to you?
Yeah, it's not present such, but I would like to add on what Dr. Puri has just said. In the minutes of health, realizing that the vector-borne diseases is starting, we need to have different sector involved. We have established what we call multi-sector collaboration platform, where we have a focal point from each unit. So that is the right platform where people from different sectors sit and discuss the issues related to vector-borne diseases and come with a joint infection plan.
Great. Any question?
Yeah, thank you. I will respond on the question from the guy from Kailuk University. On multiple factorial, the role of local government to reach the community. So as I mentioned and I said that climate resilience need a strong institution capacity, and it's very clear that the role of the local government authorities are very clear on the ground. Taking the case of Hana, it was that we worked very close with the local government, we analyzed all the situation, and we put all the strategy towards the community. And the local government was very able to reach the community with support from Amref and other partners. So to stress on that, to emphasize on that, is that we need to work and to collaborate with the local government in our spaces. But also we have the SOPs that are guiding our collaboration and our strategies that the local government can take to the community. So it's something that we need to work on that, knowing that it's only the local government that can be leaders and the other players to the community, and they have been doing very good. Thank you for reminding, and I think it's a key point to take forward.
Thank you so much, Engineer.
Asante, just to compliment also to my colleagues and Dr. Mtuli. One additional area of sharing is the chapter from Ifakara Health Institute. We have the National Technical Working Group under the Ministry of Water, which brings all the BPGs and the other partners to share and inform on various development initiatives, including the climate change issues. On technology application, Madam Felista, very local technology which is being adapted by the children in schools, Kibuchirizi, to emphasize on the hygiene promotion in terms of now econo epuka kuharisha. Can you say nami? Say nami. Unajibu eku. NAMI means nawa mikono. Epuka kuharisha. Epuka kuharisha, nawa mikono. So this is a technology really that has been promoted in schools and replicated back into their respective families. Thank you.
Thank you so much. Round of applause to our. Now, for the interest of time, we know people have a lot of questions. We are supposed to close so that other group can come in. And that takes this opportunity to welcome our guests, WHO Regional Director, Africa Elect, to present some awards to Amref. Take some photos.